Having a shoulder issue, definitely more working out, not on a everyday type of thing.
So when you work out, what kind of limitations do you notice?
I notice my right back is engaging more. A lot of the muscles are definitely engaging more, and just doing certain workouts like lateral raises, I'm getting like a pinching feeling. Can't really go too much overhead.
Can you show to me when you do that lateral raise? When do you feel that pinching?
Right there, it gets tight.
Okay, and point to me, where do you feel it?
More in this area. Right here.
Okay, so tell you what, why don't you do a lateral raise for both arms? I see, okay. Put it down, one more time. Okay, so what I'm seeing over here is that your scapula on your left-hand side over here is much more elevated and higher than your right. Your right scapula and the AC joint is moving and engaging. Same thing with your clavicle and the SC joint over here. On this one over here, try again, raise it up. So your SC and your AC joints, they're not engaging too well. Something's stuck over here. Put it down. Okay, let's turn around. Okay, turn around all the way. Now, so you notice incline benches, which are lateral raises are a problem. What other exercise you notice?
Incline bench, I'm getting the front part hurting.
Okay, we'll talk about that in a moment. What about the seated rows or bented rows?
So when I'm doing rows, it's more like when I go all the way back, I feel my left side not engaging, but I also feel the stretch here because I'm trying to engage my left side of my back, if that makes sense.
Okay, hold on a second, let's turn that. Is that yours?
It is.
Okay, you want to shut the sound off? Okay, so, all right, so now, have you so start from the top. Okay, so have you noticed any issues doing with seated rows or bented rows?
Yeah, so basically when I'm doing any type of rows, I feel like the left side of my back is not engaging as the right side is. And when I try to engage my back and pull my arm just a little more back, I feel the stretch in my shoulder. Doesn't feel too good, but it's not too painful. I just feel like I'm just compensating on the right side of my back. I'm not getting the full engagement on the left side.
Because I'm still seeing here your scapula is not moving too well compared to the right one over here. Okay, so turn around once more again. Now you were mentioning something about incline benches.
Yes.
Okay. So when you try to do a bench, where do you feel the problem?
It's going to be more in the front area right here.
Okay. Any other issues you noticed?
Definitely clicking, a lot of that. Yeah, it's more like just coming up. As I'm coming up, I get that pain here.
Okay, can you try to mimic doing a press? Okay, there's something going on here as well.
And I feel like to me, when I'm in the mirror, you can actually physically see the difference in both my shoulders.
There is a difference here. There's something going on over here. No, yeah, your bicep tendon is misaligned. Okay, we gotta set that one in there. Yep. You feel that tendon right there?
Yep.
That's the bicep tendon, okay? The bicep tendon should be here. It's way over here.
And I have gotten pains where it's run down to my bicep and tricep as well.
Correct. So basically what's going on is this. We're supposed to have a ligament between these tubercles over here that keeps the bicep tendon in place. But because you don't have enough nerve function to that ligament, that's why all it takes is a misaligned scapula and the final stroke brought the camel's back. What it did was it kind of knocked it out of its groove. Sort of like having a padded screen door that jumped the track. Okay. It's not fully off the track, but just partially off the track. Okay. We just gotta nudge that bicep tendon back in its groove. All right. So now let's talk about the mechanism of the shoulder itself. All right. And these are areas we're gonna evaluate and take a closer look at. Now, most health providers, okay, and everyone knows when we hear about this, okay, there's a shoulder problem. We're constantly focusing on key areas. Okay. We're gonna look at the top part, okay, the upper traps, okay, the levator scaps, so on and so forth. Okay. We'll also talk about, okay, what's going on with the rhomboids over here, right? But the most often overlooked muscle I see with a lot of shoulder cases actually is your lats, okay? And as you can tell, the lats are attached over here, but the other attachment site is way down here. So that's why I need to evaluate from the ground upwards, what's going on with the anchor point, with the lats all the straight down to the lumbar and the pelvis here. We're also gonna take a look what's going on the lower rib cage, mid and upper back, okay, for your upper traps, mid traps, lower traps, and also the rhomboids as well. And also in addition to, we'll take a look at upper traps, levator scaps, and all the other muscles coming from the cervicals. And also in addition to this region over here, these nerves over here, it needs to supply proper nerve function to go all the way straight down into the shoulder complex. So as we mentioned before, if you don't have enough nerve function, especially we see with this one over here, that goes straight to the tubercles between the bicep tendon. I'm sorry, to hold the bicep tendon in place. Don't have enough nerve function, bicep tendon, well, even though I said it, it's always gonna keep popping out every single time you try to do your workout. Okay. So that's why we're gonna take a look, see why you have a traffic jam there. Restore the nerve function, get you from here to get you over there. Right now, we're looking at some potential areas of concerns. And we're finding several already. Okay, there's quite a bit. Okay, so let's see what's going on over here. There's some swelling. There's a speed bump over here. There's some pulling and swelling over here. Seeing the story over here. See, it's nice and puffy. See, it even sounds different here too, because why? There's edematous fluid over here. See, same story as well. This one's so close by, it's also a problem as well. See, there's your neck, swollen here. So now we're gonna check. Okay, slightly fixated. There's a problem over here. How's this feel over here? Tender?
Pressure. I don't know if it's tender.
This is not moving too well. See, all the other segments moving just fine. The second sacral segment, that's in trouble right there. Fork lumbar's in trouble. Okay. Okay, 11 dorsal's in trouble. Six dorsal. Third dorsal. Yeah. Second, okay. Interesting. Okay. So you got a lot of muscle spasm. You feel that big knot over there?
Yeah.
Okay, your body is trying to stabilize something that's very unstable here. See, that 6 cervicals in trouble. See, you got a partial atlas fixation right there. Okay, all right. So your SC is not moving at all right there. So you can't go anterior at all. You can't go, so we have an AX humerus right there. Okay.
Oh, that was the click right there.
Yeah, your scapula is not moving too well either. See, it's just not moving right here. See, on the medial side, it's moving. Lateral side, it's stuck. See, medial fine, lateral fine, that's moving. See, that's moving. Slightly stuck here. Slightly fixated anterior, not too bad. Slightly fixated there as well.
Years and years ago, I tore my ACL and meniscus, got surgery, had a motorcycle accident, fell off, retore the same thing. Ever since then, depends on what I do. If I run or go downstairs, it can come out of place and go right back in. So it's unstable.
Gotcha, gotcha. All right, let's take a look. Okay, so go to EP, P to A drawer test. So there is some laxity going on over here. It's kind of loose. See, you feel that? It's a little loose here.
Yeah.
See, it's kind of decently stable here. See, the fibula's out. Yeah, your fibula's out. Tibia's out as well. Your femur's okay, but see, your tib fib, both of them are out. So for the foundation itself, all right, upon this analysis, ideally I want the sacrum over here more close to 45-degree angle. Okay, it's backwards. In addition to, we see this nice big bubble in there, all right, and a little gap going this way. So the second sacral segment that confirms it, though, this is in trouble. In addition to, I want to see all these segments over here leveled. But upon a closer examination, the second sacral segment over here is wedged this way. So as a result, that's what we start to see, the lumbar start to tilt that way, right? But since we can't go our body tilted like this way over here, okay, our body and our head needs to go back to here. So that's when we start to see all these other compensations going on over here as well. The fourth lumbar is also compensating this way. Okay, your 11th dorsal is compensating this way, 6th dorsal compensating this way, 3rd dorsal compensating that way. Going up to your 6th cervical, also compensating that way. All to try to address with the anterior atlas on the right-hand side. In addition to, see this over here? This is your spine of the scapula over here, okay? Compared to your right. See how much more higher it is on your left?
Yeah.
Okay, so your whole entire scapula over here, as we see, it tilted this direction. Okay, and also went elevated as well. So we have a superior lateral scapula over here. We need to address, realign that fellow over there. This is a right shoulder model, but you could get the idea with the left one. These are the tubercles I'm talking about over here, right? Now the bicep tendon goes right through here. Now, as I mentioned before, there is a ligament that attaches from here to here. And it needs to stay firm and taut to keep that tendon in place. Okay. However, if you have a cervical or neck subluxation resulting in a traffic jam and not enough nerve function to it, it becomes loose. All right. Now, I'm not saying again that the tendon goes way off track, nope, but it's enough to go like right over here. Okay.
Gotcha.
So even though, and with today's visit, I'll set the tendon back in its groove, if we don't have this thing nice and firm, it's going to keep on jumping the track every time you do a workout. So that's why we need to address your neck as well. Deeper. Just drop the belly. A little more. Go ahead. Come on up.
Oh, shit.
Walk around.
Oh. Wow.
Tell me, what's different?
I feel kind of looser, like my lower back.
Good.
It's not as tense on the right side.
Okay. Try to do a squat. No. Let's show it to the ear, Louis. Go ahead, try to do a squat.
I guess I can go a little lower.
A little lower.
Definitely a little lower. Oh, shit.
Come on up.
Oh.
Language, bro.
I'm sorry. I get the same thing at work. Wow. I definitely feel looser.
Nice.
I don't feel, I always had tension in my back. Yeah, definitely helped a lot right there.
Nice. Go ahead. Do that little squat there. Let's see what you can do.
Yeah, definitely go lower. For sure. Still a little uncomfortable for me because I'm not really a squatter, but definitely can go lower.
How's the knee feeling?
It actually feels good. I never had too many problems because I never used it as much. It was always if I'm running or if I'm going downstairs, or even if I stand here and I turn, that'll come out of place. Just leaving that there, my knee will come out of place. So it was never like a walking type of thing. It's not like I used to walk and it used to hurt. I would have to walk for a long time for it to hurt. So it was more like other exercises, running and things like that.
So while you're twisting that knee of yours, do you notice any changes with that?
I feel like I can go farther now without feeling like it's gonna. That's probably about as far as I can go with feeling like it's gonna come out. But I could definitely turn it farther now, I feel like. I never really tried before because I was always scared that it's just gonna come out. But definitely an improvement.
Nice.
Definitely an improvement, for sure.
All right. No, that's what we're talking about, man. We've got to restore the nerve function to it so the ligaments can now hold onto stronger and better. A little more. A little more. Good. See right there. Good. Go ahead, relax. Drop your shoulders, just relax. There you go. Good. Just let it go. Good. All right, stand up. Now give that shoulder a try. See how you like it.
Wow, that's crazy. I'm not getting the stretching no more as much. Like when I want to pull back.
Mm-hmm.
But what I do feel is the left side of my back is still not engaging as much.
Not surprised about that, yeah? Okay, go ahead, try to do a lateral raise. Yeah, your scapula's still out. Okay, let's get the rest of it. Let's see, this is not moving at all. Let's set this. There we go. Come on up.
Oh, wow.
Have a seat. Yeah, SC is still jammed. Hold on a second. We're gonna set this. A little more. There we go. AC's jammed. Good. Bicep tendon still out. Let's set this. Now you feel that right there?
Yeah.
Okay. Your groove is right here. Feel that?
Yeah,
it's swollen tendon. Yeah, because the ligament's swollen. So what we're gonna do is this. We're gonna grab onto this. First things first, we're gonna rotate out. Get the tendon in. Okay, I'm hooked onto the tendon right now. Nope, dang it, it's slippery. Yeah. Got most of it. Gotta get a little more. There we go. There it is. Coming up.
I felt that one. Oh, man.
Okay. All right. Give it a try.
Yeah. Definitely better. Yeah, definitely better. But when I try too hard, I feel it want to come out. Right now, I just felt that. Like if I go too far back, I feel exactly what you just fixed, like it wants to come back out.
That's what I'm saying. We need more nerve function to that ligament. It's not fully restored yet. Okay. All right.
Yeah,
Go ahead, do a lateral raise. How's it now? Try to go a little higher with the lateral raise.
Wow, I wasn't able to go that high without any, like, you know, I had a restriction to about here. So now, yeah, I could definitely go higher. But the higher I go, the more I feel what you just adjusted.
Yeah. Okay, let's try to get a little for that neck. Just relax. Relax shoulders. You gotta get more nerve function. There it is.
Oh, man.
Coming up.
Wow.
Ooh. Now try that shoulder. Okay, now let's face it, the camera over here. Go ahead, try again.
Yeah, definitely better.
Okay, do that lateral raise high as you can.
That's about where I'm stopping at.
Okay. How's the bicep tendon feeling now?
I don't feel it. I don't feel it. Feel it here.
All right.
So about like right here, I would say is no feeling, no pain. That's where I feel it. So yeah, it's a significant difference. But what I will say is doing a row, I still feel this part of my back engage more than this part.
Okay, let's show the views over here.
Okay. So if I'm rowing, I can feel my right side of my back engage.
Okay, relax, relax. That's why. your ribs out. Feel that? That bumpy part?
Yeah, it was a little tender there.
Yeah, that's a rib. That's what's blocking the rest of it. So this fella, gonna set, drop the belly.
Oh.
There it is. Come on up. Okay. All right. Turn around. Turn around. Turn around. Okay. Now do a seated row.
Yeah, it's definitely engaging a little more.
Yeah, it is. And now it's actually working here. There you go. Feel that right there?
Yep.
So we're gonna pump this up. Okay. Got a little bit of a Baker cyst feeling in there. Okay, the joint capsule is swollen. Pump that up before we set it in there. There we go. See, now we got more range of motion in there. Now I can set this fella. Just, here's one. It was still out. All right. Yeah.
Oh my God.
Here goes that. Okay, come on up. Oh.
It feels super loose now. Yeah, I wasn't able to do that before.
What do you mean by not able to do it before?
I can never go too high in that range. So for me to do that, I can probably even go higher than my right knee. Yeah, definitely feels like I have almost more mobility.
Nice. Try to twist on it. See how you like that one now.
Wow. That's a big difference. Really big difference coming this way. I can never do this. Really, really big difference. That's beautiful right there.
I'm glad you like it.
Yeah, definitely. Definitely. Needed that for a long time.
Glad to be of service, man.
Yeah.
All right. Oh, thank you. All right, so here's the bottom line, okay? Because we want to minimize further damage to this fellow over here. We did our job. We removed the traffic jams out of the way. We got more nerve function to that. And on top of that, we also realigned it better. But see over here? Okay. This is your vastus medialis oblique muscle, okay? Compared to here. If you feel this one over here, it's nice and firm.
Yep.
Over here, you feel that? It's weak. All right. So I need you to strengthen this VMO muscle over here. So how do we do it? What you do is this. You turn your foot outwards by 45-degree angle, okay? Get some ankle weights on it. At first, right now, I want you to do just body weight. You just try to raise it this way, and you should feel a nice tension in your muscle over here.
I do actually.
Okay? Once that starts to get strengthened up even more, after a couple weeks of doing that, then you start putting ankle weights. Okay? And then you go to the next level, and then you start doing, with the quad machine, and just gently add, tack on some more weight to strengthen that VMO. Then start working on the quads, your hammies, your gastrocs, doing calf raises, so on and so forth. All right?
Beautiful.
All right? That's what the battle plan is.
Sounds great.
All right.
Sounds great. On the road to recovery, man.
You got it. Oh, one more thing. Try to go like this. Okay? Okay. No, stay still. Hold on to it. Does that produce any problems?
No.
No problems at all, right? Okay. Here's another exercise I want you to add on to help strengthen your shoulder. Do some Supermans, okay? And also get a kettlebell, right? I don't want you to have the kettlebell swing down. I want you to try to keep it upright. Okay, start with a 10-pounder, okay? Or 5 or 10-pounder, okay? You start from here and slowly go outwards, like this. No, from here.
From here?
So you're gonna do a kettlebell from here to here, all right?
Gotcha.
That's gonna help strengthen and stabilize your scapula and your whole entire shoulder complex from there. All right?
Beautiful.
Okay, that's all it takes, brother.
Nice.
Oh, you're very welcome. See you next time, man.
Yes, sir. Thank you.
You're welcome.
Appreciate it.